and welcome to today's CME activity. There is no commercial support. The speakers and planners have disclosed no relevant financial relationships with any commercial interests. You will receive a SurveyMonkey link after today's activity. If you're viewing online, we will enter that into the chat section, and if you're viewing after the fact, you will find the survey link in the description section of the video. It is my pleasure to introduce Dr. Supriya Manapalli, who is our Medical Director for Infection Prevention and Control.
Thank you, Jennifer. Our speaker today for ID Grand Round CME event is Dr. Siddiqui. He completed his medical school at Sabah University School of Medicine in the Caribbean in 2009, followed by his IM residency at United Health Services Hospitals in New York. He initially practiced as an academic hospitalist for 2 years at the University of Buffalo prior to pursuing his infectious diseases fellowship in 2016 at Virginia Tech Carillon Clinic and Roanoke, UVA, Virginia. He joins us now from the Medical College of Georgia in Augusta. He's been with us for a couple of years now, and he's our dedicated outpatient infectious diseases provider. And he's focused on short-term or short duration of antibiotics, COPAT, transitioning patients from IV to oral earlier. I think we all are learning from him a lot on that. He primarily practices, as I mentioned, in our ID outpatient clinic. On his free time, he enjoys biking, swimming, and baking with his wife and 3 little kids. Please join me in welcoming Dr. Siddiqui.
Thank you very much, Dr. Manapalli and Jennifer. This honor to be here, and hope I can keep it a little entertaining. And it's the good thing it's not gruesome, because my last talk was something maybe not too appetizing during lunchtime. So the topic is emerging infections and future pandemics. And as stated, I have no disclosures. So the objectives are to identify the causes of emerging global infections and to discuss ways to prevent future pandemics. So I started with this just to bring home that what's been going on in the world unfortunately leads to infections and pandemics, and I'll get to that, but I just thought I'd start with this cartoon. And we all know that climate change is a reality. And this is just from NASA, pictures. And what's more important is that it seems like we have a role to play. It's not only natural forces. So we have a lot that we can be hopefully doing to save this planet and prevent, the climate change. And what's the big deal for health and for infections? This is from the American College of Physicians, and showing how everything is interrelated. I like to quote Lion King, because I watch with my kids, that there's a delicate balance. And so everything that happens, with pollution affects health. You see, everything is related. Mental health, hygiene, nutrition. Everything is related, and so as you see, increased climate change, all of these, the flooding and heat waves, drought leads to loss of habitation, poverty, mass immigration, violence, and all of that negatively impacts our health, as you see down here. I know there's a lot going on this slide, but basically it's showing that climate change causes all of these negative effects on our health. And these are the numbers showing how climate change has affected our health and caused death throughout the world. And you can see this is from the World Health Organization. I'm not going to read all those numbers, too much numbers, but so how does it affect health? And I'll just go into a little bit of climate change. So increased wildfires we've seen since 2020, record-breaking. It causes many people to go homeless. Projections indicate that wildfires will increase as climate change increases. This is from the New England Journal of Medicine. We also see increased temperature and changing rainfall. So you see increased number of vectors, infectious agents spreading, and we will see a lot more of these communicable diseases like dengue, malaria, hantavirus, salmonella, giardia, and cholera. Increased temperature also causes the mosquitoes and anopheles like malaria. They require a higher temperature to survive. Water scarcity also is a side effect of the climate change, and that increases diarrhea worldwide. And here's another table just showing how everything is intertwined with, I like to call it, bug and the we have different types of pathways, to the human being that we have our own barrier, but then they're breached by these bugs that we have, and by not only our own host problems, but also the manipulation of the environment. And you can see how they're all related here. So I'm just going to go into a few different organisms that are thought to be emerging infectious diseases. Again, there are a lot more that can come out that we don't know, that we're not familiar with. But one of them is Japanese encephalitis. So it requires 22 to 23 degrees Celsius for mosquito development, and 25 to 26 degrees for transmission. And so we would see this a lot, spreading a lot more with the climate change. Extended periods of hot weather increase average temperature of bodies of water and food environment, which also cause the growth of algal blooms, and that causes Vibrio to grow and cause diarrheal infection. Salmonella requires temperature between 7 to 37 for reproduction, and we know salmonella, what it causes, organs can affect all the different organs, and they spread very easily. Also, for these mosquito viruses, temperature variation are important for the distribution and incidence of dengue. Increased drought and excess rainfall also increase the abundance of mosquitoes. This is a little blurry, but basically we're looking at the bars going up based off temperature. The higher the temperature, the more mosquitoes. Recent analysis indicates that number of dengue cases have been as high as 400 million per year. Climate affects dengue virus and vector populations both directly and indirectly, as we see here. And I don't mean to be gloomy and have pessimistic, but this is just how things may turn out if climate change is not addressed. And as you can see, the spread of viral infections over decades will just get worse and worse. Lyme is another infection that is affected by climate change with increased storms and precipitation. Increases the spread of the vectors and ticks. Also, West Nile has increased. SARS also, although it is inactivated in sunshine, but maybe increased sunshine hours and temperature increases Vibrio. Wind causes spread of diseases as well. Dust particles increase attachment and viral surviving in transportation. Asian dust storms have increased bacteria and fungi as well. Influenza A has also been higher with Asian dust storms and viruses transported across ocean by dust particles. Increased rainfall also increases diarrheal infections, and unusual precipitation after long drought can increase pathogens causing outbreaks. So basically drought and low rainfall also increases waterborne pathogen. Increased humidity increases malarial growth in the mosquito, and temperature and humidity during rainy season in Singapore increases dengue virus propagation in mosquitoes, contributing to outbreaks. Migratory birds also contribute to transmission of viruses, and H5N1 outbreaks were tied to fowl migration. Increased temperature leads to increased insect expansion into higher altitude. Malaria, trypanosomiasis, Lyme, tick-borne encephalitis, yellow fever, plague, and dengue have also distributed more widely. As winter temperature increases, Onchomolenia upensis, intermediate host of Schistosoma japanicum, also extends its distribution to northern China. And I mean, I'm going through this really quickly, and I'm just remembering this morning from a clinic patient asking me how to put it into easier terms. But basically, infections can spread anywhere. Like we see a bug that usually lives in the gut, like Enterococcus, or we see bugs that are more likely in the mouth, Strep viridans. But we see them spread. We see herpes, 1 and 2 spread based on the activity of what's going on with the patient. So similarly, just think of that, with as the globe, as things change, you're going to have spread of different vectors. You'll see that are not normally in one area. Like we tend to think of things geographically, especially on the boards for those studying their internal medicine boards. They'll talk about, geography is very important for infections because if you're traveling to Southwest California, in the desert, in Arizona, you'll think about coccidioidomycosis, or if you're you're coming from overseas, you're thinking of Japanese encephalitis. But the idea is with climate change, it's shifting everything. Like everything is just going to be mixed up, just like with herpes, cold sores up here, down there, herpes 1 or 2, or with, gut bugs ending up in the brain. It's just based on the behavior, what's going on, that's spreading all these pathogens. So during times of drought, water scarcity results in poor sanitation, increased contaminated water. In 1993, epidemic of diarrheal disease was due to Cryptosporidium, due to heavy spring rains. And by 2030, it's estimated 10% more diarrheal disease than there would have been without climate change, especially affecting children. So with COVID, we were always worried about that. It's expected that there may be more. Also neglected tropical diseases like dengue, rabies, trypanosomiasis, Chagas. We may be seeing more of these as well. Also antimicrobial resistance is another factor that we often try to combat as infectious disease doctors with antibiotic stewardship, because studies show that about half the time antibiotics are not needed and half the time they're ordered longer than necessary. And so what that does, as we all know, causes antimicrobial resistance, and it's responsible for at least 2 million illnesses and 23,000 deaths per year. It's estimated to kill more people than cancer and diabetes combined by 2050. So the idea is you can't just wipe out the bugs. They come back, they get mutated, they will be more difficult to eradicate, as I try to explain to my patients that the bugs get smarter than the drugs, unfortunately. So what can we do to prevent future pandemics? Immediate restrictive measures have revealed the most efficient actions. So social distancing, lockdown, case detection, isolation, quarantine, and contact tracing. Other measures: track and forecast community outbreaks, early and aggressive implementation, public hygiene, characterization of pathogens, and vaccine development. And at a global level, stepwise alert system by World Health Organization. So convening with expert consensus to establish an objective evidence-based epidemiological and containment criteria to transparently guide its decision-making processes. And this is from Lancet Infectious Disease 2020. And what have we learned from the previous pandemic is importance of staying home when we're sick, maximize on technology, so virtual meeting, and then switching patient visits as well to virtual meetings and visits. Also, surveillance of wildlife and high-risk pathogens, so reducing the amount of consumption and the interaction with wildlife, and improving biosecurity of wildlife trade and animal markets. As physicians, we also have a social responsibility. This was in an article by Dr. Bivens, that nuclear war, the ultimate never event, is a catastrophic inevitability unless we eliminate nuclear weapons and arsenals themselves. And that's reflected in this diagram showing how decreasing climate change, also avoiding wars and being more green may have less conflict and prevent infections overall will help our health. And so how can we as individuals have a positive influence? And I think maybe the tone of this talk is a little depressing, but there's always light at the end of the tunnel. I like to be positive and have an optimistic approach to life, that there are certain things, and we have a saying in my faith that Prophet Muhammad, peace be upon him, said that if the end of time is coming and you have a seed in your hand, plant the seed. You don't care about what's the result. You just want to do good. Whatever good you can do in your capacity, just do it. Whether that's smiling or saying a good word to somebody, cheering somebody up, whether that's picking up trash that you see when you're walking on the sidewalk, whatever positive effect that we can do as individuals, that's what we need. And we don't necessarily see the change all of a sudden, but the change will come eventually, that we will see light in the world. And that includes all the suffering and the violence in the world that we see. We need positivity, love to spread, to take over the anger and the hatred. So this is something that I try to live by, that maybe hopefully I can continue, is to decrease consumerism and consumption. I don't have a picture of this, but there's basically tons and tons of, we know the loads of garbage that we put out. I'm guilty of that every day. More the studies show that probably 40% of food is wasted. It's not needed. It's hurting the environment, and it's also going to spread. It's going to cause climate change, and it's going to also cause spread of infections. Also, just food in general, junk food, processed food, fast food, meat consumption increases climate change as well. So I try to, do maybe once a week, once a month, cut down a little, eat more fish, and avoid plastic. I try to walk around with this, and recycle whenever you can. Transportation, so biking and walking whenever you can. I know it's dangerous. I was telling my staff as a light, joke that if you don't find me here, you know what happened. Maybe I get hit by the crane because I'm walking while they're doing construction there. It's not always easy or feasible, but carpooling, recycle, and I appreciate my staff who came, that carpooled. Thank you for your support. So electronic use is another thing, and I love using electronic medical record, and I know how we suffered just one day when we had to go back to paper. So I know that it's really beneficial, and it's amazing that we have, electronic medical record, but I try to at least shut down my computer during my lunch hour and also at the end of the day. I'm not sure, I have to talk to IT what's better, because sometimes all of these are just like in sleep mode. But I think from what I know is that it's better if you shut it down if you're not going to use it the whole night. And that goes for everything else in the clinic or in the hospital area. If there's no need for lights or machines to be on, then it's good if we can close those. Avoiding, this is something I talk to my patients all the time. So trying to have a healthy diet and lifestyle. Again, we mentioned that already, staying home when sick, getting vaccinated. That's something we often get a pushback from patients, but I think as providers, the way I try to explain to my patients is that you get, if we all get telemarketer calls, so you can block some of them, but some of them are smart, they call you through a different line. So that's how I explain to my patients, and usually they become more receptive to getting a vaccine, because they're like, oh, I always get these vaccines, I still get flu or I still get whatever, pneumonia. I explain to them that, you can only block as much as you can block, but it's better to at least block the ones we can. And if you get it, that's just fate. And unnecessary antibiotic use as well. And then when in doubt, you have all the wonderful ID minds. More so they're in the hospital than me in the clinic, but we're always available and happy to help out. All right, so I got through quicker than I thought, but so we have question time. Anybody like to read the question and answer? I think I made them fairly easy.
Should we have someone do it?
Sure, I mean,
Okay.
whatever, how do
I mean, that works for me.
usually,
Who shall we pick?
what the process is, I'm not sure.
Oh, we have a volunteer. Excellent.
All right, which of the following is true? I'm going to go with C. Climate change causes emerging infections.
Very good. I'm sorry I don't have any candy for you. But
That's okay. He gets an A for the day.
very good. All right.
And question number 2. Also, let me mention, if you have a question online, if you'll just enter it into the chat section and we will ask for you. All right, let's see. Question number 2. Here we go.
Oh.
Thank you.
Which of the following is an emerging infection? And all of the above?
Very good.
I think you're right.
You're ready
Yay. Thank
for
you.
your ID fellowship. Number 3 is the last one.
Okay, we have one more. Do we have a volunteer?
I have up front, Maria.
Oh, we have one. All right, hold on.
What can we do to prevent future pandemics? All of the above.
Excelente.
Yay.
Thank you so much, everyone, for your attention and coming out in support. Once again, I hope it was not too pessimistic, but this part of the reason I went to ID is that we feel like, you know, we're the ones that everyone comes to when some pandemic starts. And I'll just say that in the beginning, we never knew COVID would turn out this bad as it did. And so sometimes we all lose control, but we're all a team. We all work together, and we hope that we can save humanity together and kill the bugs when we need to. But as I say to the patients, they're not always bad. They're like C. diff. You know, they're keeping things in balance, and sometimes you know, we don't necessarily treat things that we see on culture unless there's a clinical correlate. As we know, when we're ordering labs or imaging, we always have to consider, you know, the pretest probability. So when you're ordering cultures or imaging, always keep that in the back of the mind. That is this something that really the patient may have an infection or not, and then just keep an eye on outbreaks. And even in your own home, sometimes, you know, we're forced because of work, we don't want to take a day off, but if you're sick, at least you can put a mask on and try to take a day off if you know that your kid has something. Or because I have kids and they always like petri dishes, they bring a lot of things home and I bring things home too. So keeping that in mind, you know, a lot of times it's more than just the bug, it's your own overall health. If you're strong enough, you can fight it off, because it's usually colds, you know. And I explain to patients, this is something that I was not taught, like I felt like could have been more pushed in fellowship about just general things, how to prevent getting an infection. So for instance, not blowing your nose too hard, not coughing too hard, because that causes, you know, blood vessels to tear, and it causes the mucosa, the turbinates to swell, and that causes obstruction. And the body and everything, the world was meant to be in motion. So if you're having a runny nose or whatever, you know, not always stopping it, plugging it. You know, if you're having issues with the gut, same thing, you know, with C. diff, if you give a stool, you know, if you give them Imodium, they can develop toxic megacolon and rupture, and you'll have an acute abdomen. So not always using drugs, but using non-medicinal therapy is also something that, you know, helps a lot of times to prevent, you know, the spread of infections. Just common, you know, things we know in hygiene, covering our face when we're coughing or sneezing. These are common, but they're often some things that general population may not know or need a little kind reminder. So thank you very much again. Any questions?
Dr. Siddiqui, thank you again for a great talk. Just wanted to mention that I was at the ID Society meeting recently, and it was less about ID, more about climate change, because climate change is the #1 threat for emerging infections. And I don't know, you may have already read in the news, we have, I think, first time in the history, we have malaria in cases here in US in those who have not traveled outside of United States. We also are seeing, it was in the news, of Vibrio vulnificus infections in New York, North Carolina, and not in the Gulf of Mexico or those places we normally see. We're already seeing the change. Bugs that live in animals are jumping into humans. And of course, the pandemic in the last few years is another example. And bugs that are supposed to be endemic are not staying endemic anymore. They're becoming more resistant to survive the climate change. So this is the #1 threat. Thank you again for the talk.
My pleasure.
We have a question right here.
Thank you, Dr. Siddiqui, for the great presentation. I had a question, especially because, I'm coming from Mumbai, India, where any patient coming with fever, first thing we start thinking about is vector-borne diseases, dengue, malaria, and so on and so forth. But over here, we don't see those cases. I must have seen maybe one malaria case over here. So do you think United States is ready for, prime time in terms of, considering to do workup for dengue, malaria from the time patient walks into the door for with fever, because right now only when we do all the workup and still we don't have a cause for the fever, then we label it more under fever of unknown origin, and then maybe we do extra workup, and that time maybe we may consider. Although there are cases where there are classic symptoms associated with malaria or dengue or other conditions that you spoke about, with classic symptoms and signs and travel history and so on and so forth, and then we start working in that direction. So do you think that America is already ready for that, or there's still more time?
Yeah, that's a good point. And I feel like it's something that should be worked up and looked at, especially as Dr. Manapalli mentioned. So anybody that's coming, any travel and fever of unknown origin, I mean, taking a good history and then, yes, including anything like that in the workup is prudent. I actually haven't seen that much as well, but we do. I've ordered malarial smears and dengue serologies on patients, and sometimes interestingly, a lot of these serologies they have cross reactivity. So you may have seen for fungal infections as well. Like histoblastoma may have cross reactivity. Similarly, these arboviruses, vectors, and they may have some cross reactivity. Dengue with chikungunya or Zika or anything else. So definitely taking good history is important. Travel and looking at the CDC website and then seeing what their activities are. So exposures, and if they've had histories, being bitten by mosquitoes and avoiding. So things that we know how to prevent, is avoiding, the dawn and dusk time. That's when they come out more, the mosquitoes, stagnant water areas, things like that. And then wearing DEET, 30 or 50%, which you can get from the Walmart or anywhere. That helps prevent a lot of these West Nile, dengue, Zika, and all these. So reminding patients to spray that insect repellent whenever they're going out in the woods, and use long sleeves and wide brim hat, which I brought over walking here. All those things may help, prevent those infections as well.
Okay, thank you, Dr. Siddiqui.
Thank you very much, everyone.